Hello and welcome to CDO Magazine interview series. I'm Andy Sajus. I'm the field CTO with AHEAD, and we're partnering with CDO Magazine in a series of interviews with today's data and technology leaders. Today, I have the pleasure with talking with Scott Harrison, Chief Data Officer at Parkland Hospital. Thanks for joining us, Scott.
Thanks for having me. I appreciate it.
Great. So, Scott, tell us a little about yourself and Parkland Hospital.
Yeah, thanks. Parkland is the county safety net hospital for Dallas County. It's been in operations for about 127 years, serving the underserved population for our community. We're largely funded by public tax dollars. Private funding is not common in the public health space. So much of what we do at Parkland is to really reach out into our community to provide outreach and improve care through our communities. I've been at Parkland for just almost 3 years now, serving in my role as Chief Data Officer. Prior to that, I've had about a 25-year history in healthcare, serving in various roles. I started actually as in nursing, and then switching over after about 12 years into health information technology, and really spent the bulk of my last 13 years in that space. And data and analytics has been my passion since making that transition.
That's great. So obviously you bring a deep healthcare experience. And I think what we've seen from the healthcare industry that is over the past, let's say, year and a half, it's met significant challenges.
Right.
How have you seen technology become a supporter of business goals that you may have not seen before?
Well, I've seen kind of two sides of that coin. I've seen it enable the human reach, specifically when we talk about, some of the things that we operationalized during the pandemic. I've seen it really enable humans to do much, much more, but I've also seen it be a barrier. And I think, I want to qualify that statement that, as an industry, healthcare is relatively immature in the technology space. Up until the mid 2010s, most organizations across the U.S. were undergoing some type of implementation of their electronic medical record and some of the other ancillary systems, trying to connect that digital ecosystem that is in large part happening in most of our systems today. The challenge is, from a data perspective, is there was a lot of hasty implementations of some of those digital solutions, and so it's created a mountain of technical debt. And oftentimes, data or analytics or data management, some of those practices, to really operationalize, some of the technology and drive that data, that value from data, was kind of an afterthought. And so, in large part, there's kind of what we call in certain areas of the industry, the haves and the have-nots. And, I'd put Parkland kind of in that haves group where, we have the capabilities to quickly integrate new data and operationalize technical solutions and really drive out the data that helps provide our clinical and operation leaders with the information that they need to make good decisions. And that, in large part, isn't the case across many, many healthcare organizations in the country. And so, when I get on various calls with other constituents in the industry, some of what they're trying to do is the basic keep the lights on. How do I structure a team? What kind of roles do I need to have in my, created in my organization to support, data engineering or ETL or persistent integration for some of these sources that we're having to do today. And so, I wanted to qualify that statement that, when you look at areas of industry like finance or, the petroleum and gas industry and really mature areas of our industry today, they've been very mature in analytics for a long time. And, healthcare is in that space right now where we're trying to cross that chasm and really catch up. And so, much of what we're doing today is leaning on the shoulders of giants, and taking some of the best practices that they've already implemented and trying to massage those best practices into a healthcare space.
I think you hit on something there in regards to operationalizing data with not only your physicians and your clinicians, but align that to business goals. And I think on that note, I want to ask, do you have a mantra when it comes to data process and governance when aligning that to specific business goals?
Yeah, that's a great question. And we actually do. It's something that I'm proud to say that I brokered into Parkland on my arrival. And that's really what we call an analytics first approach. And when we take on any big project or initiative at Parkland, what we try to answer up front is, what does success look like and how do we measure that? So not only do we want to hear from our business stakeholders subjectively what success looks like, but we also want to know how we measure that, because most of what we're implementing has the capabilities of telling us little bits of information to say, hey, was this a successful endeavor? And when you're thinking about the public healthcare space, like we at Parkland are in, we have to really scrutinize what we take on, because we're funded using taxpayer dollars. So are we providing that the good to the public that we need to? And so that's something that we always try to start any project or any initiative with is, what is our goals? How are we going to measure that?